Hello and welcome to this edition of Bayou Time. I'm your host, Keith Weissite, licensed clinical social worker. Always glad to be joined by a colleague who can help fill us in and talk with us about one of the very difficult epidemics we have going on in our country. Leilani Brunet with South Central Louisiana Human Services Authority are in there doing a lot of education, and we appreciate it. I know fentanyl is one of these things that we've been talking about. It's one of the things that people hear about, but I'm not sure that people understand how fentanyl really works.
Right. And I'm not going to get into too much of the chemistry of it, but to basically explain it, it's binding, these medications bind to the receptor sites in our brain. They bind there, they hold on really, really tightly, and the areas where they're binding to is what's responsible for our breathing, our blood pressure, our respirations, and so all of this stuff gets suppressed. And we have to get that fentanyl or any opioid off those receptor sites. And the medication that we're using to do that is Narcan. Narcan's also attracted to the same receptor sites, but it has a higher affinity. So Narcan can get into the system and bump all those opioids off of those receptor sites and replace them, and the person starts breathing again.
Temporarily.
Temporarily,
right?
correct, absolutely.
Something really important for people to know.
I'm glad you said that, because that is vital, because this is only going to have a half-life of about 90 minutes. So this individual has to get to the emergency room. They should be monitored at least 2 to 4 hours after being resuscitated, because if there's any residual left, they could go back under again. And so good news is that since 2017, there's a standing order in the state of Louisiana. So anyone can go into a pharmacy and ask to purchase Narcan, no questions asked, and they can purchase Narcan.
And we had some discussions with law enforcement about that, and it's truly, they're not going to go and arrest somebody for the use of drugs. They're going to make sure that they're going to find a way to get them the help that they need.
Exactly.
And let's get them that help. Because we've had some situations where people didn't understand that getting Narcan or waiting to get Narcan is not a good idea.
No.
But even once you give that Narcan, you still need to get to an emergency room.
That's right, because they will come back, but they could go back under after an hour and a half or so. They could go back under again because of the residual.
And one of the things I didn't realize is that some of the emotions they can feel: happiness, drowsiness, nausea, confusion, sedation, respiratory depression and arrest, unconsciousness, and then death.
Yes.
And that's why that's important, because it's such a wide range of emotions that people may see, and they may not realize that as a fentanyl overdose.
And when they stop breathing, they go into respiratory arrest. They're going to go then into cardiac arrest, and then that's the end of it. So it's vital that the Narcan is available immediately. EMS may not get there immediately, and if someone can have it on them, they could resuscitate somebody quickly before they even get there.
To administer that Narcan and then find a way within that 90-minute window.
Yes. Well, actually, yes. After the 90 minutes, the medication is only going to last 90 minutes once they've been resuscitated. We want to get them follow-up after they've been resuscitated for a couple of hours, 2 to 4 hours.
Gotcha.
Yeah.
Gotcha.
And I want to talk a little bit about national and state and regional data, and I'm going to move kind of quickly through this. There's tons of things out there that you can look up for the different numbers. I use the Louisiana Opioid Data and Surveillance System, LODS, and anybody can go there and look up this information. But I pulled 3 components out that I want to look at right now. The national level in 2019, there were 72,000 overdose deaths in the United States. In 2020, we had 93,000. Now, of those deaths, in 2019, 51,000 of those deaths were directly related to opioid. Well, actually, opioid was involved in some way, and 69,000 in 2020. Now, when I break it down on a state level, I get those same categories, but I'm able to add in an opioid poisoning category, and what that means is there were 1,334 deaths in 2018. 470 of those, there were opioids in the system, but 447 of those were directly related to opioid. The death was caused by opioid. And then in 2019, we had 1,486, and then 588 of those cases, opioids were involved, but 563 opioids were the direct cause of that death. Now, I have written their location. That's the location where the death occurred, not necessarily where the person lived. That wasn't necessarily their resident.
But that's almost 100%.
That's almost 100%. And if you look on the regional level, that's our region, Region 3. There was 100 drug-involved cases in 2018, 16 opioid-involved cases, but 15 of those were directly related to opioid. And in 2019, in our region, 102 deaths, 34 opioid-involved, and 34 opioid involved, excuse me, and 32 were directly related to opioids.
We're talking to 95 to 99%.
Yes,
in those two.
And then if I break it down even further for us, we'll look at our parishes.
Okay.
And you can see Lafourche had 12, St. Charles had 6, St. Mary had 6, Terrebonne had 5. Those had opioids involved in the deaths. But if you
Okay.
break it down even further to, was opioid the reason? Was that the poisoning death? Then yes, Lafourche had 12, St. Mary had 6, and Terrebonne had 5. The reason they don't show St. Charles here, or even St. James or St. John, is out of respect using HIPAA laws, because it gets down into geographically, those areas are so small that if you listed those numbers, you could actually figure out who that was. So
Right.
in respect of HIPAA laws and for the individuals themselves, they don't break them down when the numbers get that low. They'll either mark it as 0 or suppressed, and that's what's happened here.
And so just to be able to recap a little bit, what we're seeing is not just opioid involvement, but we're seeing opioid poisoning.
Directly the reason that person expired.
People are dying because of opioid poisoning.
Poisoning,
this is
yes.
not just involvement, but poisoning. Their
Yes.
system's been poisoned.
Yes.
That's important to know.
Yes.
And that is what we are seeing with regards to this fentanyl. It's what we were seeing with regards to this opioid epidemic. Leilani, I thank you so very much for coming
Absolutely,
on, sharing
absolutely.
some of these statistics, letting people know kind of how this happens and how it works in the brain and the body. Very, very helpful. So we
Yes.
appreciate your
Happy
time for
to be
that.
here.
All right,
Absolutely.
glad
Thank
to
you.
do it. All right. And again, that's Leilani Brunet. She does a lot of education and training as an RN with South Central Louisiana Human Services Authority. So very glad to have her on to share with us what to do and how to deal with this epidemic. All right, that's going to do it for this edition of Bayou Time. Don't go anywhere. Local programming up next.